Welcome to my video explaining the new cervical screening guidelines. The new guidelines are due to come into force in the very near future and are already in place in Australia. I have been asked repeatedly about these guidelines, so I've made this video to make it easier to understand. Firstly, what will we be testing for? We will be testing for the different HPV types. Currently, we test for type 16 and 18, which are reported as being type 16 or 18. We also test for other high-risk HPV genotypes. These include the following, and these are collectively reported as other genotypes. It hasn't quite been determined what will be tested for with the new regime. However, we expect it to be the same as the current regime. So how will the testing be done? This is going to be done via a smear test. How frequently do we expect testing to be done? It is proposed that the testing will now be done 5-yearly. It is also proposed that we change the starting age for screening by raising this to 25. The reasons for this are 1. HPV infection and cell changes associated with it are common in women under the age of 25, occurring approximately 1 in 3. This is particularly so in those who have not been immunized against HPV. In younger women, these infections commonly disappear on their own without treatment. Screening women under the age of 25 therefore could lead to overdiagnosis and overtreatment. The second reason for this is that cervical cancer in the under 25 age group is rare and not usually detected through a screening program. There is also a proposal for changing the exit screening. In the proposed pathway for primary HPV screening, women will either have an HPV test at the age of 69 or they may have an exit HPV test between 69 and 74, that is, within 5 years of their last screening after the age of 69. So what is the actual process? An HR-HPV test is done. HR-HPV means high-risk HPV. If this is negative, the patient will go on to routine 5-yearly screening. If this is positive, it will either be reported as high-risk type 16 or 18 or other genotypes. If it is type 16 or 18 positive, the lab would automatically do a liquid-based cytology test and refer the patient in for a colposcopy. If the other types of HR-HPV are detected, the lab will once again automatically do an LBC test. If the cell changes are low grade or less, they will repeat the HR-HPV in 12 months. If this is negative, they go back onto 5-yearly screening. If this is positive for any type of change at 12 months, the lab will automatically do an LBC test and refer for colposcopy. If at any stage the cell changes are more than low grade, then the patient will be referred for a colposcopy. The colposcopy pathway has yet to be determined, but it is anticipated it will be very similar to our current colposcopy pathway.